Action.
Action. My name is Dr. Mary Diaz, and my colleagues or fellow researchers are Dr. Uletis, right? Uletis and Ms. Nancy Nadeau. Our study is entitled Hispanic Nursing Students' Resilience during the COVID-19 pandemic at a university in South Texas. And before I start, I'd like to, not related to the presentation, but I'd like to say a joke to kind of get everybody feeling better. And that is, there was a gentleman who was speeding, and this gentleman was stopped by a state trooper. So when he stopped, and then all of a sudden, he took off again. That was the gentleman that was speeding. And so the state trooper went after him. And as he went after him, and he stopped again. So the trooper came up to the older gentleman and said, "What's the matter? Why did you flee?" And he says, "Well, I have a story to tell you." And that story is that a state trooper actually took my wife from me because she left with him, and so I don't have my wife anymore. So then the state trooper said, "So?" And so he said, "Well, I was afraid when you came after me that you were going to return my wife to me." So anyway, so being that we discovered in COVID-19 that we had students with an emotional burden of nursing in the undergraduate program, and being that our literature background did not have any references in relationship to Hispanic students, we felt that we needed to evaluate our own group of students and to see how they were impacted by the transition of online learning and the cancellation of practicums, clinical practicums during the pandemic. We did go to the IRB and got our research approved through the university. And so therefore we started. And in our background search, there were articles by Santos, Labreg, and Fagueri in 2022 that have described that many nursing students were concerned about the interruption of their education and how the change would affect their careers. However, once in the clinical practicum, the students were concerned about the probability of exposure and getting infected during their practicum. Not only that, but that they were in danger of the health of their families. Even before that, pre-pandemic stressors were already current in the nursing curriculum, because as described in research by Jimenez Esper in 2020, nursing students have a vigorous curriculum. They have heavy course loads, stringent examinations, and the pressure to attain high grades. And this is to continue their education and achieve higher educational goals. So students must have a high GPA to be accepted into the master's and doctoral programs. So this adds anxiety, stress, and depression to students that already have undergoing curricular changes. Better in 2015 talked about the students' own pressure to succeed, and yet the pandemic caused an instability of securing graduation and post-graduation employment. Many hospitals, locally and international, did not allow students to be placed in hospital facilities for fear that they would be exposed and infected. This caused increased anxiety and stress, which resulted in students not wanting to continue their education or failure by not completing course requirements. Thus, academic failures, dismissals due to fear of disease, and the inability to complete coursework related to the lack of clinical practicums. Fitzgerald and Kovac in 2021 discussed that nursing students endure long clinical hours working with clients that are suffering and dying on their assigned shifts. These emotional traumas of seeing their clients die caused additional emotional grief, especially for a new nursing student. Jimenez, an expert, and according to Savitis, Finding, Airy, and Hundell in 2020, in addition to the COVID-19 crisis, this type of an environment has led to the development of mental health problems such as PTSD, insomnia, and depression. The goal of our study was to assess predictors of stress and anxiety and depression among undergraduate Hispanic nursing students in a Hispanic serving institution during the COVID-19 pandemic. Acquiring knowledge regarding the experience of Hispanic nursing students during the COVID-19 pandemic would thus allow for an analysis and understanding of the students' experience and needed actions to improve student support during any crisis or pandemic. These identified actions, which my colleague will explain later, could be implemented to support students and decrease stress and fear during nursing school. This would allow the student to become a member of the medical force. So how do we assist students to become resilient and bounce back after a challenging situation? And my colleague, Ms. Nadeau, will speak to that. Nursing is a needed profession. The nursing shortage in the United States is driven by many factors. One is the increase in the need for care. Two is that a lot of nurses are reaching retirement age. Recent healthcare legislation and just nursing burnout from working long hours during COVID. So now Washington is projecting to have the largest nursing shortage by 2035 with a 26% shortage. In 2021, U.S. nursing schools turned away more than 91,000 qualified applicants due to a lack of faculty, educational space, and resources. Important to our nation and clients is that we retain and graduate as many nursing students already in our programs. Important is our support of nursing students during the nursing curriculum. And nursing schools across the country are struggling to expand their capacity to meet the rising demands for care. Thank you, and my next presenter.
In the meantime, that my colleague, Dr. Eleftherio, I want to tell you the study design that we have done. We did a cross-sectional online survey using self-reported questionnaire. Those are the questionnaire that we use. Number one, a mental health psychometric score. So we use the PSS stress, the GAD-7 to evaluate the anxiety, and we did the PHQ-9 related to depression. We did the coping support mechanism, so we use for faculty support the SPFFSS. We did for the resilience, very commonly used, is the CD-RIC-10. We want also for the Hispanic background to see what's going on with the family, so we use the APGAR, the family functioning, and because of the strong faith of the Hispanic community, I'm looking at the spiritual well-being, and we use the CIWB. In the research, we look at the demographic information such as age, group, gender, first generation status, the race, the Hispanic ethnicity, and an international student. The family life, for me working at UTRGV, which is the University of Texas Rio Grande Valley, the family is very important. So we're looking at marital status, children, whether the family, the father or the mother is born in the United States, the single, if they were single or living alone, single living with parents or with other relatives. The professional status, we're looking at, we have the BSN student and we have the second degree accelerated student in all different semester. That was part of the population that we deal with. And the health status, again, if they have received the vaccine or if they had been infected with COVID-19. So for the statistical analysis, I'm going to introduce Dr. Eleftherio. Thank you.
So for statistical analysis, we use the Cronbach alpha to confirm that there's internal consistency in the response to the questionnaires. We also identified all the coping and support mechanism measures and the covariates that have statistically significant correlation with the mental health psychometric scores using the Kendall-Tau test and the Kruskal-Wallis test. And then from the coping support mechanisms and also the other covariates that were found to have statistical correlation with the mental health psychometric scores, we selected the ones that did have a correlation, and we built a preliminary linear regression model. And then from that model, we used a procedure where we tried to minimize the archaic information criteria to identify a reduced model. So the idea is that the original model may overfit the data, may have too many parameters, many of which were not statistically significant, and then we incrementally remove and add parameters to find the model that results in the best fit. Now, as sample description, we have a many details in our paper, but basically the highlights are that out of 260 students that were invited to participate in the survey, 82 students responded. However, from the 82 students, only 74 students actually completed the survey. Now, and those 74 students are the data set. Now, from those 74 students, we have seen that the majority is female, 79.7%, 95.9% is Hispanic, 20 to 25 year age bracket is the majority of 78%. The majority are single living with parents at 73%, and 83% of the students do not have children. Now, none of those students was an international student. 39% students reported that they have a U.S.-born mother. 41.9% reported having a U.S.-born father. All of them received the COVID-19 vaccine. 27% experienced being infected with COVID-19 during the stay as students in our institution. 20% of the students are second-degree BSN students. 47% are not working in any field. 29% work in a field that's related to nursing, and 23% work in a field unrelated to nursing. Now, the Cronbach alpha scores show that pretty much the responses to all the questionnaires are internally consistent, so we have confirmed that that is the case in our questionnaire. And the descriptive statistics for the psychometric scores are as follows. So we have seen that for stress and depression, those are limited to moderate levels for a strong majority of the respondents. So we see that, so they're concentrated here for stress, and also for depression, they're concentrated below the moderate level, or at the moderate level at most. But anxiety is spread out more evenly across all levels. So 16% of the students responded having severe anxiety, although 10% of the respondents have reported no anxiety and 12% of respondents have reported no depression. None of the respondents reported no perceived stress. So basically everybody had stress. Now, these are the descriptive statistics for the coping and support mechanisms. The most notable observation here is that 28% of the students reported moderately dysfunctional or worse family function. So that is the APGAR score. So there's 23% with moderate dysfunctional family and 5% with dysfunctional family. In the other categories, we see that they're doing well. So most students basically report at least moderate faculty support, at least moderate strong resilience, and also moderately good spiritual well-being or better. So basically they're doing very well in all the other categories. And these are the results from our finalized model. So I can skip through all the other intermediate details, but the final result that we got is as follows. Now, for this model, this is a linear regression model, and to make the coefficients of the model easy to interpret, we rescaled all of the questionnaire scores on a scale from 0 to 4. Now, the dichotomous variables, these are basically things that are true or false, yes or no variables, were rescaled from 0 to 1. And the main findings that you see here is that negative numbers basically mean that increasing these things reduces the corresponding score, and reducing it is a good thing, so you don't want to have too much stress or anxiety or depression. And so negative is good, positive is bad. Positive means that it makes things worse. And so what we have seen is higher resilience is a statistically significant predictor for reducing stress, anxiety, and depression. Higher family function is a statistically significant predictor for reduced stress. And higher spiritual well-being is a statistically significant predictor for reduced stress, anxiety, and depression. Now, there's some other interesting observations. So you see, for example, that students that experienced COVID reported more anxiety. And also, interestingly, students that reported working as salaried healthcare workers, we have seen that this has had the tendency to reduce anxiety and also to reduce depression. And this is a summary of the findings. So as far as the coping and support mechanisms are concerned, we have seen that higher resilience, higher family functioning, and spiritual well-being contribute almost equally towards the reduction of stress. So these are all three of them are important parameters. All three of them make approximately an equal contribution to the reduction of stress. Resilience and spiritual well-being contribute almost equally towards the reduction of anxiety. For the reduction of depression, there's some hierarchy here. So spiritual well-being makes the strongest contribution. Then the next is increasingly weaker contributions are by resilience, and then by family function. So the three predictors here, they do not have an equal weight. We have seen that faculty support score does have a positive correlation with reducing stress and also with reduction anxiety. Now that one is not statistically significant, but it's 0.06. So if it had been less than 0.05, we would have said it's statistically significant. So it's almost there. Reduced depression, also it's borderline, not statistically significant, but again with a 0.07 p-value. So these are not statistically significant predictors of mental health in the linear regression model. So basically, the students did receive faculty support, but it didn't have as much impact as the other parameters. Now, COVID infection was shown to be a predictor for increased stress. It was not a predictor for anxiety or depression. And there's different plausibility arguments one can make. So one argument that you could make is that for students that have gone through a COVID infection, they no doubt they have natural immunity, so they would expect to be better protected, and that could tend to decrease their stress level. But on the other hand, there's other things that can increase stress level as a result of the infection. So the duration of illness can have disrupted the student studies. That would tend to increase stress. Any long COVID symptoms or any impact of the infection to other elderly family members would also increase stress. Now, we did observe that having experienced COVID infection was not associated with increased anxiety or depression. So at least in that sense, it didn't have a severe impact to the student mental health. Working as salaried healthcare worker did have a statistically significant association with reduced depression, and borderline not significant association with reduced anxiety. So that was an interesting finding, that students that did that type of work actually had experienced better mental health. And the other observation was that we have seen that students that had US-born father, that was associated with reduced stress, but again, it's not statistically significant. However, the confidence interval is very compelling, so it's mostly on the negative side, which means it had the beneficial effect, and there's just a very, very small little piece here on the positive side. Now, we think this could be a confounder maybe for socioeconomic status. It doesn't really make sense why that would make any difference. So this is a summary of our findings. Now, Ms. Nato will conclude the presentation.
Thank you. That the implication, the population that we use was most of them, because I teach in the 4th semester at the university, so I know kind of all of them, and what your numbers say or demonstrate that, yeah, I have observed that. During the time that 2020, that the COVID came and then we went to lockdown, which for us in South Texas, in this Hispanic institution, we have to stop clinical. However, we had enough clinical that we shift to a more virtual simulation to continue the hours that we need to do. So, but we find out that we need to catch up to provide virtual clinical instruction. So that nursing application would be the improve the effectiveness of virtual clinical instruction. And because UTRGV was one of the POD, meaning there was a point of distribution of the COVID. One of the things I find that when they demonstrate that provide increased resilience and spiritual well-being throughout the development of strategy throughout the curriculum, we provide aid via both psychological and technical support. So I was looking at the latest, article regarding to that. Jean in 2023 find that spiritual health is essential in maintaining and promoting physical and mental health to achieve happiness, potential, and meaning and purpose in life, even during the pandemic. Those photos is, I was in charge to make sure that we have the nursing student to help during the distribution of COVID vaccine. So on that part, I will make an assumption here. The faith of the Hispanic will stand together, and they will. Family is very, very important. So when we offer to them due to the grant during COVID, they were paid. They received some money to be able to not only for their clinical, but also paid for continuing the distribution of vaccine. I think that create a sense of purpose, a sense of value of self. So that make a very, that probably helped to decrease the anxiety and the depression. Stress still there, but it was not as much that we were thinking it is. So when we have some what we have done is to give them more virtual clinical instructor, because it's clinical instruction, because it has demonstrated from that research, but what we saw, that it is a value to have high virtual fidelity simulation. Very expensive, thank you for some grants during COVID, to really help the nursing to prepare them for what is happening. Now, the targeting addition faculty support and psychological support, UTRGV has as a structure organization has helped to offer the services, but also the faculty support to have them, how you're doing, to be there with them online. So that helped, I think that helped the teacher and the peer support or pedagogic resources that enhance nursing student mental health and competence development. So from that part, we have what is show that it seemed to have worked that we have provided. I did change the course because this is a face-to-face course that became an online course. And on that part, how do I provide writing journal, and be read by the faculty, and if we detected that they need some additional help to have an intervention. So faculty support was in that nature. Family was very important, what I say. Now I like to finish with this part. Nursing resilience is a positive adaptation that was reviewed in 2022 with Dakan and all to adverse condition and stressor. It is considered as an ability to overcome stress and create balance in stressful and unpleasant work environments. Resilience is an act of cognitive flexibility. Several factors affect the resilience of nurses, including the living condition, the cultural background, and the socio-demographic characteristic. And that's from that research is really targeting, we are an Hispanic community, and what are the distinction compared to others, because there is other research that did in different part of the world, and not only in the United States. And we find that, it's important to integrate resilience tools during the curriculum, so we prepare the future nurses to deal with other global pandemic. I don't know if my colleague, Dr. Diaz, you want to add additional comment on that?
As far as resilience and as far as being able to assist students with that, I think that there needs to be a curricular strand within the programs to assist students to become have higher resilience. And because it's not something that's learned, so a lot of times the students come to us, but they don't really know how to problem solve. And so when things are changed, they get very upset, very stressful, and they don't think of it as a positive change or an option, but they look at it as something negative. And higher resilience really is about looking at life in a more positive stance. And so that's basically all I have to say, is that we need to be able to support our students, because again, in my introduction, 21, 91,000 students were turned away because we didn't have the facility to take care of them. And now, the nursing shortage has gotten so high that the quality of care is not what it used to be. So we really need to get our nurses out. We need to get them graduated. We need to make sure that they're competent, of course, to take the nursing exam. But again, that's one thing that is hurting right now, is that we don't have enough nurses to take care of patients. So the quality of care has decreased. And I can say that myself because I was recently in the hospital, and it's so different from before. That's it. I don't know if y'all have any questions for us.
Thank you. Have you experienced, during the COVID, in part of experienced healthcare and the nurses? Have you had that experience? If you want to share your experience.
Well, and I apologize for coming late, lunch is scheduled at the same time
I
as
know.
the sessions, but I guess as I was listening and you kind of touched on this, I was wondering about in the curriculum that students are engaged in now, what does this notion of resilience and spiritual well-being look like? Because I could see that as not only being important for the students, but for patients who come in demonstrating their reliance on some element of spirituality, and how students and how nurses are able to respond to that from their own experiences. So I just don't know at what level resilience and spiritual well-being, whether it's curricular or co-curricular, might look like at your.
To answer that question, because of my position as a director, is looking at from the first semester to the last semester. I prepared them for their license, but on the fourth semester we have community. And for me, community is very important, community engagement. And really take the strength of the Hispanic community and go out. And really, because I want to realize it's more than only themselves. It's the purpose. And whatever faith they have, because we have mostly we're Catholic background, okay? And La Virgencita that you have seen, it's very strong. So when I say, when we go take a blood pressure and we do teaching, sometime you may influence one person and you have that connection, and you see them when they do their report. We do a critical thinking, and I do a self-assessment that go with that, and I can see that it's reflected when I read their own journey, and from the beginning to the end, because the fourth semester will bring the first semester, so they can experience. So how do I implement community engagement and the sense of purpose, your own inner strength, to reflect the outside, the purpose of why you become a nurse. To become a nurse is I can see it, and you probably see it because you're a nurse too, is they have it. And some is like, okay, let's work. It's somewhere, I need to put it out so you can reflect it, out and be with your patient. So I think it's important to have the faculty. For me, it's a vocation, it's a call, it's an inner call to become a nurse. And being a role model and create assignment that will develop that skill. We try to make sure we have from the first semester, but in the fourth semester, I'm pushing very strong the soft skill. Because in the third semester is all the technical skill, but the fourth semester is really coming, okay, you have that now, I need to brush you up like a diamond. I need to brush you up so you can shine when you finish in your program and you become a nurse. So I hope I answered your question that.
And they have issues with disaster nursing where they have to meet immediate kinds of responses. Don't
Yeah.
you do that too?
Yes, we'll do the disaster
And
part,
so
but
at
it's
that
still a
point-
practical things. But you mentioned something important is when I'm in clinical with them and the patient die. So how we help them throughout that process. Also, it's or that's not them, but when they're the classmate or the nurse, the primary nurse that was there lost a patient. So we also do part of what that call is. And let me tell you, if they're not, nursing is not for them, it will be identified in the first semester and they will drop. Mhm.
I'm glad you touched on that. I am talking to you not only as an educator, a licensed professional counselor in the K-12 system, but also personally a survivor of my late husband who went through his transition to heaven. And in the beginning of the pandemic, during COVID, I didn't understand what the healthcare industry and all of its complexities are until I got into it with my husband's medical transition. As a counselor, I'm an advocate. So I got to deal firsthand with many directors.
Yep.
Some of them at which they represented the hospital, true enough. But in my professional contact with them and engagement with them, a lot of them are in the field and they lost sight of the purpose. They lost sight of the meaning of what a human life is and the value of it. So there were a lot of times when I was negotiating on behalf of my husband because he had lost his voice in the paralysis of having so many strokes. The advocacy piece strengthened me to voice, not only for him, but for me, for us as a couple to survive through this gruesome healthcare system. I lost respect for the healthcare system, knowing that I was firsthand in the muck. Having to deal with the survival of a human being, and there were times when I had to stand out and stand up and ask the rhetorical question, why are you even in the field when you don't even care about human beings at the very least? So how do you teach that to fellow potential nurses in your particular genre of your ethnicity? And I will say that my bias is when I came across the Spanish nurses, they were more empathetic and more real and compassionate than the other ethnicities, including African Americans. It hurt me as just a patient's wife to see that there's still even discrimination within the health field.
Oh yeah.
So how do you teach empathy to a child that wants to be a nurse?
And again,
being
because it would probably need to start with me as an educator, a nurse educator, how I see my own inner strength in my profession and how I can see the light in the future nurse to be and bring it out. What you're talking about is two things, the ugliness during a disaster and also the greatness during a disaster, because there is both. There is some that has a fantastic and miracle that time, but what happened when the story is in the other side? And how you're coping with this. Because again, we advocate for our patient and we want a happy ending, but the happy ending during the COVID went like less and less, but you have to work. But I find the resilience in Hispanic, and I saw that in Katrina hurricane, the Hispanic community in comparison with the Black community in New Orleans, you can see that. Me being a mixed race, I find, and being from Canada, living in Mexico, come here now, and I live also in Europe, very interesting to see the influence in different background, your living condition, what is going on. But to reflect back your question is, how do I teach compassion, empathy, and it's what it is within themselves. I'm very sorry for what happened, and again, how can we find something positive in this gruesome outcome? But I hope that, you know, we make a difference in my student, that it will reflect back in the practice.
But do you give them, as students, do you give them real life historical application for them to really get it before they leave the classroom, that this is a very compassionate field that takes the inner core of oneself and meaning, including all the encompasses of religion and who you are as an individual, to care for the life of another?
I will say, we are successful. Do I have everybody on board? Sometimes I have to let go, and I say life will teach. And hopefully on that experience that you will grow and stay in nursing or get out of nursing, okay? But my part is really this is how I see them, and when I do the last speech in the pinning ceremony, I say the light, and go out. Someday you're gonna have good days, some days you're not. You may not agree with administration. You're gonna do your best, but in the Hispanic community, it's more that there is something greater, and their faith, and how many candles has been laid out from the Virgin. I see that during their time, or they bring them their medal, that they have something inside from what they're born, and sometimes it can be challenged with, you know, your cultural background.
So my second question is to you.
Thank you very much.
You talked about a vacuum, a high vacuum of turnover in healthcare. What is being done to fix it?
Let's have the next session.
I'm sorry.
I just want to tell you that what we do,
We can talk about that later.
let me just real quick, since you're all set up, I do some empathy type of work in my mental health, because I teach mental health, and they don't understand what a schizophrenic or what a person who's going through a psychosis is feeling. So we have a simulation where they hear voices. They're hearing voices during the period of time. And so what happens is that before and after, they feel, now I can understand what the patient is going through, because I thought that basically they were just, you know, not wanting to participate. They didn't want to really get involved and get a job, and it's not that. It's that they have a condition, and somebody needs to be there to provide that assistance.
Thank you.